Thank you very much, and um, I would like to thank the thank Dr. Sengal and Dr. Wong for the invitation. My talk, I will emphasize on the interactions between metabolic risk factor and the alcohol in the outcome. And uh, as Dr. Wong has emphasized, has already talked about the nomenclature and has emphasized that the disease state is actually very dynamic, and we will touch on those. I'm going to be talking about the interactions between the risk factor, and I will specifically look at outcomes including the fibrosis progressions, cirrhosis, and cirrhosis complications, including mortality, liver cancer, and so on. This is a study that look at fibrosis. It is a study that has two parts, a Spanish part that has a derivation part and then a validation part that is done in the United States from the NHANES. We will look specifically at the part that is the NHANES part that includes the pre-pandemic NHANES. It includes patients with, specifically, it includes patients with metabolic risk factor, and it requires a patient that has the FibroScan and has a CAP score of greater than 275. That is with hepatic steatosis. Most of the patients do have MASLD, and a smaller amount of patients have MAT ALD. Patients with MASLD, most of them have a very low amount of alcohol intake, while some do have moderate alcohol intake as well. In here, they classify patients into having very low alcohol intake, that is having 0 to 4 drinks per week, and then the low alcohol intake, 5 to 9 drinks per week, to moderate alcohol intake. And these still falls within the spectrum of MASLD, and then to have increased alcohol intake consistent with MAT ALD. You have two panels. The panels on the left-hand side, it is stratified by the number of cardiometabolic risk factor. As you can see, while stratified by cardiometabolic risk factor, you can still see that by increasing the number of alcohol intake, even though they are low alcohol intake, there is a very clear increase in the risk of increased fibrosis by liver stiffness. The liver stiffness definition is of significant fibrosis is liver stiffness greater than 8 kilopascal. And on the right-hand side, you have it stratified by alcohol intake, and you can see that after stratified by alcohol intake, when you have increased the number of metabolic risk factor, you also increase the risk of having significant fibrosis. So the next slide summarizes the finding by increasing the alcohol intake or increasing the number of metabolic risk factor, you increases the chance of having significant fibrosis. And these risk factors are synergistic. As you can see, you move towards the right upper corner, your risk of having a significant the chance of having significant fibrosis increases synergistically. The next study that we want to look at is the risk of having mortality, liver-related admissions, and liver cancer. This is a Finnish study. Patients were followed from year 2000 to year 2013, a total of 8,300 individuals were followed long term. Those participants all have fatty liver. And the first publications from that group look at which risk among the interactions, which of those metabolic risk factor is actually the most important. What they find is that the BMI is interactions is actually not that important when compared to the waist circumference and the BMI. So the BMI and waist circumference interactions is actually the most important interaction. The next study actually looked at what happens to the interactions in terms of the chance of having advanced liver disease, cardiovascular risk, liver cancer, and all-cause mortality. Is there really a J-shaped relationship? And what they find is that for advanced liver disease, there is clearly not a J-shaped relationship, and the risk of having advanced liver disease increases after having 1 drink per day. For cardiovascular disease, there is potentially a protective effect. For cancer, after having 2 drinks a day, the risk also increases. For overall mortality, there is potentially a protective effect with very low level of drinking, but after having 1 drink per day, it also increases. What about having wine? Clearly, for liver-related mortality, wine does not appear to be protective. Over here, the reference is a lifetime abstainer. As you can see, drinking wine does not appear to be any different for liver-related complications. Over here, the comparing the wine drinking versus other kinds of beverages does not appear to make any difference. But for cardiovascular disease, wine preferential drinkers appears to be slightly more protective. Of note, there is likely a synergistic effect between smoking and alcohol drinking that we should also take into account. As Dr. Wong has pointed out, alcohol consumption is a very dynamic event. Many patients changes their alcohol consumption. In this Swedish study, they look at what happens when patients changes their alcohol consumption. Among 15,000 MASLD patients that were followed, 12% had prior history of either alcohol liver disease or alcohol use disorder. And it was found that these patients has a 3 times higher risk of having adverse liver outcome, including cirrhosis or liver cancer when compared to patients that never had a history of alcohol liver disease or alcohol use disorder. So this is a Japanese cohort that followed 3 million patients, and among those, 600,000 has a diagnosis of MASLD, 100,000 has MAD-ALD, and 30,000 has ALD. They look at what is the overall prognosis when comparing these 3 groups. And what they find is that for liver related outcome, alcohol associated liver disease appears to be worse. For MACE cardiovascular outcome, they have less cardiovascular outcome, but overall prognosis, alcohol associated liver disease is the worst. And in terms of overall, in terms of prognosis, the MAD-ALD is somewhere between the 3 groups. So in conclusion, alcohol increases the risk of significant fibrosis in a dose-dependent supra-additive interactions with cardiometabolic risk factor. And among specific risk, diabetes and waist circumference being the most important. Light alcohol use above 1 drink per day increases the risk. Wine may improve protections against cardiovascular disease, but clearly not liver-related outcome. Smoking may be synergistic, and previous diagnosis of alcohol liver disease is also a risk factor for cirrhosis and HCC. Overall prognosis of for MAD-ALD is better than ALD, but worse than MASLD. Thank you very much. I will stop the sharing.